While this trend line provides a frightening visual of our reality, the more terrible truth is that over 8,000 people, over 8,000 people who were beloved members of their families are not coming back, and their deaths are an incalculable loss to their friends and their family, as well as our community.
In the week since Los Angeles County's Director of Public Health described the reality on the ground in Southern California, the situation over there has only gotten worse. The state has set and reset the nationwide record for new cases over the past week. Officials say 1 in 80 residents are infected in L.A. County, the nation's most populous county. And with less than 100 ICU hospital beds available, an average of 2 people in L.A. County are dying from the virus every single hour. Those are terrible numbers. Joining us now is Dr. Barbara Ferrer. She is the director of the Los Angeles County Department of Public Health. Thank you so much for being here. These numbers are so difficult to read. They're difficult to comprehend. They're difficult to experience. That goes without saying. LA County has seen the number of deaths rise 300% every day since, I believe, November 9th. How in the world do you get a handle on this?
Thanks so much, Katie, for having me today. I mean, obviously, we couldn't be in a worse place than we are right now. And it's a worse place for us because, just like you said, we have many more people dying than need to be passing away from COVID-19. And we have, at this point, an overwhelmed hospital care system, and our case numbers keep going up. The case numbers going up is what we have control over. And it's the one place where if every single person plays by the rules, you have a chance at reducing the number of people that need to be hospitalized and then reducing, of course, the most tragic ending of all, reducing the number of people who are going to pass away from COVID-19. It's not a lot of people look at the situation we're in LA County and really, I think, have a false narrative in their minds about how we're going to deal with this. Somehow we're going to have more beds at hospitals and we're going to be able to take care of sick people and, life can go on as normal. But life isn't going to go on as normal. You can't just add beds. You have to have people, staff, well-trained staff that are going to care for sick patients. And that's in very short supply, not just here in LA County, but across the state and across the country. The solution really is, unfortunately, to ask every single person to redouble their efforts and play by the rules.
There's also a big disparity in who is suffering from this and who is dying from this. Minorities are dying at disproportionate rates. Latinos, Blacks, Asians, also those who live in communities that have bad levels of poverty. How does LA County address this disparity?
It's such a good question, and probably the most important question before us is to address the disproportionate income, the disproportionate impact that COVID-19, like so many other health issues and diseases, has on communities of color. I think right now, in the middle of a pandemic, the most important step we all need to take is to protect our essential workers. Many of our essential workers here in LA County are Black and brown. Many of them live, as you noted, in communities with less resources, higher rates of poverty. Many of them are working at essential jobs where they're really every day interacting with the rest of us, trying to make sure we have our food, make sure that we actually can see a healthcare worker and get healthcare when we need it, making sure that they're providing support at those schools that are open. All of those workers need protections, and there's 2 ways they get those protections. One is every business needs to follow the directives that they have for creating workspaces that are as safe as possible. Can't cut corners on this. Have to make sure that people have the appropriate protection. And then every individual, you have an obligation to protect other people, particularly those people that you're asked to do the very work that keeps our society functional.
I know there's a lot of factors at play here, but I wonder if the disparity is one of the factors that's driving these numbers up. Because 70% of LA County is white, do you find that maybe some people just aren't taking it as seriously as others because it's not affecting them to that degree?
Yeah, LA County, actually, the majority of people who live here are people of color. White residents make up about 28% of the population. Obviously, our Latinx community makes up over 50% of the population here. But I do think there's vast differences in what people's experiences have been with COVID-19, and that in fact that disproportionality also means that in communities of color, you're much more likely to know somebody who got very sick from COVID-19, even somebody who passed away, than if you're in a wealthier community or in your community that's predominantly made up of white residents, because that's how this is played out. This disproportionality existed for many, many months. We actually did a good job over the summer in reducing those gaps, but now with the surge, we're seeing, the gaps just widen every single day. And really, again, hardest hit communities are those communities with high rates of poverty and those communities where people are Black and brown.
I read those numbers wrong on my sheet. One other quick question. Part of the issue that people are facing is they're not being given enough money, enough of what they need to stay home. They don't have the backup from the federal government. Are you finding that's an issue?
That's the biggest issue. I mean, people are fighting public health directives because they need resources to be able to support their families, to keep their homes, and to put food on their table. We shouldn't be the enemy. In the richest country in the world, you shouldn't be making a choice between trying to control a deadly virus and making sure that people have enough money to survive. We should be able to figure that out. And we should make sure that nobody is forced to think that my survival depends on my going to work, even if I've been told I'm a close contact and I need to quarantine, or that, we're putting businesses, we're closing down businesses. We're a very wealthy country. We have months to go, and we need to figure out that safety net so that, again, these false choices that are presented to us, I think, are doing more harm at this point than they need to. People do need to really make sure that they understand that the first thing we have to do is control this virus. There's really no recovery when you have community transmission rates this high.
Give people the tools they need to take it seriously and stay home. Dr. Barbara Ferrer, thank you so much for joining us. We do appreciate it, and good luck. Senator Bernie Sanders says Democrats could have done a better job on a COVID relief deal. I'm going to ask him in just a moment. Plus, the latest on the winter storm that blanketed the Northeast with up to 3 feet of snow.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.